Peyronie's disease is a common disorder in men characterized by superficial fibrosis of the penis appearing as a fibrotic plaque. For the latest in health-related information and ways to save your life, check out the newsletter. Not quite the same definition as cardiovascular or vascular plaque. Anyhow, it leads to deformity of the shaft of the penis, sometimes with pain, sometimes without. It usually affects the base, mid-shaft, or distal shaft. There's a prevalence of 389 out of 100,000. And we were talking about that before the show. It's like, does anybody think that that number is overreported? If you do, step back and think about this. You only see it when the penis is in erection. So the vast majority of healthcare providers are not going to know about this unless the patient shares the information. So this prevalence of 389 out of 100,000, or about 0.4%, has to be a significant underreport. As mentioned, it can lead to pain, discomfort. Usually there are multiple causal factors associated: age, diabetes, high blood pressure, obesity, dyslipidemia, smoking, and trauma. So you got trauma, but then everything else is associated with what? Vascular inflammation. This is coming from an article. It's a systematic review aimed to identify the role of diabetes in the development of Peyronie's disease and the diagnosis and treatment. Andrology, which is a magazine which basically talks about the science of androgens, testosterone, Peyronie's disease, and diabetes. The results and conclusions on this article were, they did a meta-analysis. They looked at 16 different studies. Diabetes is one of the most common comorbidities associated with Peyronie's disease. And think about it, if it's not obvious, it's going to be obvious as soon as I ask the question, which is associated with which, or which might be causal of the other. Obviously, Peyronie's disease is not going to cause diabetes, but diabetes is likely to set you up for vascular inflammation, which in turn can set you up for not the trauma, but the failure to heal properly from trauma associated with Peyronie's disease. It's associated with a higher risk of development of Peyronie's disease, and it also has impact on Peyronie's disease outcomes. The mechanisms of Peyronie's disease include inflammatory status, arterial insufficiency, impaired wound healing process, especially after the penile trauma, and neuropathy, or damage to the arteries.